Hi, I'm Christopher. I'm one of the trustees at Shine Cancer Support. I'm super excited about this being our first LGBTQI session at Shine Connect. I just watched the panel with Tatum, Stuart, and Camilla discussing some of the sort of complexities and nuances of being in the community and dealing with cancer. And there's a live Q&A at the end of the session, which would be great if you could join us for that as well. Enjoy the session.
Well, welcome to Shine's Being Queer with Cancer panel. We're going to introduce ourselves and then we're going to jump right in. So I'm Tatum Druck. I'm the host of Shine's Not Your Grandma's Cancer Show podcast, and I'm also a queer lady. I also do a podcast about lesbian relationships as well. And I'm joined with two fabulous panelists. Stuart, if you could introduce yourself.
Hi, my name is Stuart. I use they, them as pronouns, and I am a cancer patient with CML, have been for a few years now, and I also have founded and run Live Through This, which is the LGBT cancer charity in UK.
Cool, and Camilla?
Hello, hi everyone. Hi, my name is Camilla Kamaruddin. I am a GP in London, and I'm also a trans GP, and my pronouns are she and her, and I advocate for a better healthcare for trans people, better health access, better human rights, and also raising trans awareness.
Brilliant.
And, I'm also a board member of Spectra London and a trustee for Live Through This.
Oh, and we're gonna definitely hear more about those organizations. So just to let you know what you're in for today. So obviously, everyone's experience, we're mainly talking about being queer in healthcare settings. So mainly when you're around doctors and nurses, and everyone's experience is going to be as unique as we all are. So, you know, you might have exceptional relationships, you might not have encountered any hurdles or any additional considerations. But in case you have, and that's the way it should be, but in case you have, we will be talking about some of the additional things that a lot of queer people find that they're also dealing with on top of having cancer and on top of there also being a global pandemic. But we're going to start sort of right at the beginning, because when we show up in a hospital or in front of a doctor, we're often not coming from a blank slate. We're often coming from having previous experiences. And I know, Stuart, when you were diagnosed with cancer, what was like your previous experience of being in hospital?
So that's a really good question, because I think sometimes with the cancer stuff, because it's so sort of disease specific, it's quite easy to focus on it, but I do have quite a lot of negative experiences of healthcare prior. So for example, one of them, I survived a hate crime and it was quite a violent one. I had significant lung problems and had to have open chest surgery. And during that time, there were a couple of nurses that reacted very differently to me when they realized who my partner was, when they came to visit on the ward, to the point where I didn't really want them to come anymore because it was uncomfortable. I felt uncomfortable just sort of walking around the ward by myself. And then sort of, you end up carrying some of those feelings as you go into your next appointment. So even if, you know, this person you've met may be new to you and maybe giving you the greatest first impression, there's still that niggling feeling in the back of your head that perhaps they're going to not be so great when they find out what the other nerves did.
Yeah. And Camilla, so you're also you know, being on the healthcare side of things, have you encountered you know, feeling uneasy around any other doctors or your own doctors?
Yes, unfortunately, I have. I mean, there are many positive experiences. I would just like to express that, to stress that out too as well. But there are also some negative experiences. When I remember one particular experience where I went to see my GP. As in the case like many of us, there's usually a lot of GPs in one practice, but I went to see this particular GP. I've seen him before, and he probably forgotten that I have transitioned, but that doesn't shouldn't be the case, and or shouldn't matter. Let me put it that way. And so when I went into to this room, and he was, he was sitting like too close to me, and then it's like, and then and as he was leering at me, and I found it very uncomfortable. And then he asked me a question. It's like, why don't you come for your cervical screening? And I said, well, I don't need one. And he said, why? And then he said that, and then I said to him, and yeah, because I'm a trans person. So immediately after I told him I'm a trans person, and his body language is completely changed. And he was like, he just suddenly becomes very cold, and he was like moving away from me, and he was just like looking at his computer, just typing away. And it's very uncomfortable for me. And I have told this experience in some trans awareness talks I've given, and I felt as if that people do not believe me, and because of that negative experience that I had, actually, it stopped me from seeing a GP for many months. And I mean, I could see that, I'm a GP myself, so I know when I should be able to go to the GP. But just think about other like non-healthcare professionals. They because of that negative experience, they just don't want to go to see the GP because they just want to go through all this negativity around being trans. Yeah, that's my experience.
Yeah, and I quite right. Like, yeah, there are some really great experiences, but the damage that can be done from someone physically moving themselves away from you right upon hearing that news it's really, I mean, I imagine it's a horrible feeling, and it's an exhausting one. So you talk about sort of carrying that and wanting to share it, yeah. But then even in the sharing of it, there's something that sort of disappears that makes you feel even more alone. And I think that's why we're doing this today, is that I think a lot of this, I know for myself, I didn't really have the space to articulate it. And I didn't have the time, right? Because you've got all this cancer paperwork, you've got like, your mind's on scans, it's on things that you've never even considered before, drug interactions, your brain is so full. And I know for me, it was, I met a doctor who, she sneered at me. And that's a really hard thing to sort of express, right? So she said, well, if you continue with this alternative lifestyle. I mean, to me, it was dripping with contempt. And I was with my feistiest best friend. I mean, like I wouldn't get on the wrong side of her friend, right? And I thought I was a bit of a loudmouth, but actually at that point I was silent, because so much of my regular power and my regular bubble of protection was gone. And I don't know who was there that day and who didn't say something. And I do think that we sometimes lock that away and not necessarily acknowledge that it takes a lot of energy. So Stuart, you run a support group. And so what are some of the feelings that like you hear about from people that are sort of navigating extra things and how it impacts them?
Well, it's much like you described, actually, this feeling of having to go through a system. And obviously there's a bit of a power struggle there, because you're feeling very vulnerable, you are the patient, you've got these people ahead of you who are helping you make decisions that are going to effectively keep you alive. So it's very hard to then kind of fight for something about your identity. And also I think as well, the example you gave is great, because something like that can, as a patient, feel quite hard to report and have people feel like, okay, are they going to take me seriously? If I can't pinpoint something expressly homophobic they said, how can I fight for this? And then on top of this, should I be fighting for it? Like, I'm tired, I should be focusing on my health. And then there's the additional thing we said about not bringing partners in. Like, if you then don't feel comfortable bringing your partner in, you do carry all of that weight yourself. You don't get to share that responsibility or go home and decode it later. So one of the things we see with people that come and attend the support group is actually an ability to talk about it for the first time. I mean, I've seen many people come and at first they're a bit hesitant, like, I'm not sure how this relates or how this is going to work. And then the moment they start talking or hearing other people's stories, they're like, oh, I felt like that too. Or, wow, I've actually, been cured of cancer for years and I've never really gotten into it, really. I've never thought about all the stuff that I had to deal with, but I didn't have time to process. And it's only now that I'm amongst other people. And we get people that join us who are, partners who've bereaved. We've got people who are in treatment, people going through diagnosis, people who are clear of treatment. We have one person who had childhood cancer and is still now unraveling everything. And it's really important to create that space, because unfortunately the current healthcare system doesn't factor in LGBT identity at all, doesn't question, include, monitor, anything like that. So what happens is you end up having to kind of put that to the side, thinking it's going to make your care simpler. And all you end up doing is not bringing your full self into your care. And you end up suffering in the end of it. And this kind of bleeds into support groups. And when you look for support, and it's still kind of interesting to me that with your holistic needs assessment, when they sit down and your CNS gets to know you, they don't get to know all of you. And unless you are strong enough to volunteer that information, but then there's this other misconception that people think that it's not relevant. People think that the two don't interact at all. So then they're less likely to provide that information. Whereas really, the whole system should be saying, we want to know who you are. We want to know who you want by your side. We want to know how we can help you. We want to know what your community and your social structure looks like, so we can see where we can fit in to make this whole process a bit better for you.
Because that's part of, like you mentioned, sort of disclosing, telling somebody, is that disclosure happens again and again and again and again, right? So I think, like, when we were doing the podcast, someone had said that, they told someone they were married, and then they were going for a scan that you couldn't have if there was a chance that you might be pregnant. And there was this really super awkward, oh, you're married. Oh, well, could you be pregnant? No, I don't think we can do this scan because you might be pregnant. No, I'm really pretty sure, like there can be. So it's kind of like, when you need to, coming out to a radiographer or a nurse or a doctor, like there's so many different times that you're assessing each time, like, how's this landing? Is this safe? How to, and you just get into, like, sometimes, like, really awkward muddles, that
I want to tail off the back of that and basically say that because we're not giving people the space to tell us who they are, what happens is your healthcare providers make assumptions based on everyone else that comes through that chair, and that's not person-centered care, and that's the problem. So then, like you said, we have these assumptions of, oh, you can't have this scan because, rather than just saying to someone, okay, tell me about your life, okay, who's your partner, those kind of things. And if you give people the passive sort of environment where then they get to lead, more often than not, they'll lead because they feel comfortable to. But this kind of correction of assumptions is trickier to do, because if someone just assumes you're straight, you sometimes go along with it. And I hate to admit that I still do it. And I'm meant to be in this world, talking about this stuff. But we all do it sometimes. And I think, especially in environments where you are feeling a bit nervous or you're not sure if you have a strong footing, those things can kind of calm. And like you said, you end up disclosing so many times over. Sometimes it's just exhausting. So it's really about giving people the opportunity to tell you who they are and asking people who they are. If someone says they have a partner, be curious.
And so, like, obviously, if somebody's trans, and especially with certain types of cancer, so if you have someone that's sitting in a waiting room that's disproportionately the other gender, Camilla, have you heard about how people have felt in that kind of situation, or how?
I think we take one step backwards, but it's like, how do you feel when you actually see your GP and then you want to express about, you want to tell them about and share about your problems. And I've discussed it with a lot of other trans people, and one of the things that they felt is that it is as if, like, everything is just that because of you being trans, okay, you have you have chest pain, or maybe you're stressed because you're being trans, so, and or you're depressed, oh yeah, because you're trans, like everything is just so centered on you becoming trans. So it's exhausting, and it's not, everything is not just because you are trans. Look at us as a person, and as a patient, and listen to what we are trying to say. Yes, we do see our GPs more often because of, because we need more help. We need more help to access hormone. We need more help to get, more support. And yes, but there is this misconception that that everything is because you're trans, and also because this misconception that that if you like maybe that if you don't agree with something, oh, you're difficult, so that is very yeah, it's quite hurtful. when when people think of you as that way. It doesn't have to be verbally, it's sometimes that it's like how we feel, it's we don't forget how we feel. I think that's quite important thing to express. Yeah,
because kind of talking about things on sort of a spectrum of that assumption that someone's straight or that someone's cis, so there's the kind of the assumptive, and then you've got awkwardness, and then you've got ignorance, and then you've got bigotry, and it can be misconceptions. I was kind of sort of thinking of where they fall on this spectrum and kind of how it feels like when you're dealing with that. I mean, I've heard of some situations like doctors not thinking that someone that was LGBT they might not be as interested in preserving their fertility because of this idea of them not having children. I was just wondering, have you what other kinds of misconceptions, Stuart, have you maybe come across?
Yeah, definitely fertility is a big one. And I think, anyone that can conceive should be given the option to figure out how they can keep that and see what those kind of issues are. Sometimes it is a little bit more complicated, but it doesn't mean it's a conversation you shouldn't be having. There are other ones due to especially reconstruction of the chest. That can be a really big one. And sometimes some people find that going through certain treatments can be quite gender affirming if they had dysphoria around their chest. And again, it's those assumptions as well, because if, for example, your doctor is assuming you have certain anatomy and you haven't disclosed that you're trans, you can then be sent for the wrong scans. That can make your care worse. There's so many factors where it's really just comes back to just getting to know the person and letting them tell you who they are. And then it's about, is your environment encouraging that? Or are we creating a space where people feel like they're comfortable? Because you're only going to tell someone who you are if you feel safe.
I think that goes back to the woman in America, that again, if you've faced misconceptions, if you've faced discrimination in the past, of course, when you go in and you're in this position where the doctors and nurses have their lives and your health and your care in their hands, that your brain can also be, trying to assess, am I safe? And what she imagined was, what if the doctor disproves, is discriminatory? What if the surgeon leaves a tiny bit of her cancer behind? And even just carrying that fear with you, even if the doctor wouldn't do that, but the thought of that, like, Stuart, you were nodding your head, like, is there like?
Yeah, it's so oppressive, that feeling, and obviously when you're going through that kind of care, you should have the most trust in the people that have your life in their hands, and you should feel comfortable and safe in that. So any fear that you're not getting equitable care is just not okay. And unfortunately, we see it all the time, and we see it across healthcare, not just in cancer. There's somebody I know who is trans and they had COVID symptoms and they needed to go in A&E but were scared to because they were scared of transphobia. And they work in the NHS. This is a pervasive problem that is preventing people from getting the right care. And then also, I think there's another thing that I know we've discussed before, but it's the fact as well that it's not really the hospital setting that always makes it difficult. Sometimes it is the interpersonal stuff, and Camilla's touched on this. Sometimes body language is a key factor. And with certain cancers, especially moving into palliative care, sometimes you're bringing these people into your home, your sanctuary, and your space. And obviously there have been examples where people don't feel comfortable with that, and they feel like they're even having to hide who they are in their own home. So I think it's really important to remember that it is sometimes that interpersonal thing, and whether the other person is afraid to talk about it or they're afraid of saying the wrong thing, if you just let someone lead and just ask them and be curious and be respectful, I think that's the first bridging step always.
Yeah, I was just not for healthcare reasons, but I did have a social worker that needed to come to my house recently. And he had expressed the view while we were talking. He said, "Oh, you know where all cancer comes from, right?" And I was like, there's no good way that you're going to end that sentence. That sentence is all downhill from here, And, but I was surprised when he said Satan was behind it. Yeah, Satan. And this is a man that has a certain amount of power. He then went on to talk about Jesus and Satan for the next 10 minutes, so I didn't mishear him or something. And so when he came to the house, there was fear. Do I de-gay? Do I, what pictures are up? Like, what do I do? And I'm not ill or anything at the moment, but like, yeah, that thing of someone coming to your house that you might need someone coming in, and that fear of your sanctuary, of your space being judged, of you maybe not getting the care that you receive, and not from a neutral person, not necessarily neutral. Like, I think, and Camilla, I would love to ask you about, like, is there ways that we can assess other signs to assess for healthcare providers being on side, being an ally?
Yeah.
Are there any clues or things to look out for?
Well, I think there are many, but I think we should try and explore kind of what are the barriers that the healthcare professionals are not providing you with the best advice that you should get. You see, and talking about cancer screening. I mean, as a patient, none of my GPs have ever sit down with me and discussed about cancer screening, and I just wondered, why is that? Maybe I said, or maybe because they don't know a bit about about cancer screening for trans people, or maybe they're just awkward or reluctant. I still don't know. So, and maybe because they're not aware about what to do, about what to advise, or maybe because they don't want to offend or saying the wrong things as well. And maybe it's their unconscious bias. I mean, all healthcare professionals have got prejudice. We all have got prejudice. I've got my own prejudice, but because of my lived-in experience, I'm able to reflect and act upon my prejudices. But for some healthcare professionals, their prejudice is based upon their beliefs and because of religion, culture, communities, and society. And yes, and this unconscious bias, and it needs to be. They need to have a lot of reflection upon this, because this is preventing the LGBT people from actually being, assessing the healthcare that they need. Yes, there are many ways that we can actually, healthcare professionals can help to, overcome this. There's a lot of e-learning now available. There's e-learning on our CGP website about cancer screening, about gender variance e-learning. And if you go to a GP surgery, you should look for all the subtle signs, for some pride flag, or a pamphlet or a poster, and I think a lot of us know our GPs. We've been going to our GPs for a very long time, and I think we should try to also build strong relationship based on on care and support. And yeah, I think that's very important, that we should try to cultivate that trust within our healthcare professionals, and also healthcare professionals must take the initiative to build that trust. And sorry.
Yeah, no, I think I love everything that you're saying. I think one of the things that I hear from that, and I know for me, like, I felt quite alone at the time, even talking about this, is that it's not all on us. Like, actually the system should be a bit better. And actually just even knowing that, like knowing that the exhaustion, knowing that the assessing, like it actually could, there are pathways, there's momentum towards it getting better. We're not quite there yet. But that it should be, I think, kind of, at least it kind of eases a little that sense of isolation or feeling just odd or different, or, you know, what I would do if my partner would go to like hold my hands or something and it was a quick swat away. Like, I don't want to deal. Like, I don't want to worry about the nurses around right now. I don't want to deal with this. Get away from me. You know, so, and I never even really thought about that until afterwards. Whereas I think actually when you do see, and Stuart, have you, like, can you tell us about the lanyards or like what signs you look for?
Yeah, definitely. So, it all comes to equitable care, you know. So, like, as you're saying, with swatting someone's hand away, I've done that, and it's a shame because then I look over at the next bed and I see someone with their loving partner doting on them with no shame, you know. So it's about what around me can make me feel comfortable that I can have that I can be that loved and cared for in that moment. And I think in primary care, so GP, there's some good stuff with Pride in Practice from the LGBT Foundation, who go out to GPs and try and train them, get them up to a standard where they're understanding. I've been doing some work with the charity, educating certain hospitals, making sure they're up to date, they understand some cancer awareness stuff. That's always really enlightening to hear how people are doing. I also do training for other large cancer charities and just get the word out there, get chatting about it and demystifying it, making people feel comfortable, making sure people can fluently say LGBT without stumbling, you know, like the basics. But I think as a patient as well, you know, there's some really good things going on with the NHS Rainbow Badge. So that's where certain hospitals will have rainbow badges that are NHS branded. And what that person has done is they've signed a declaration to say that they're going to stand up for us. And then those people you can seek out. And inside, obviously, GPs can touch on this, like if there's a poster, someone's wearing a lanyard, those are normally safe markers that, you know, someone is at least proud enough to wear it, and they may not even be LGBT themselves. And sometimes I think that's nice as well when someone who isn't LGBT is proud enough to be related to the community visibly and stand with us, because it's also fantastic when you identify an LGBT doctor and that's the person you can go to, but it's nice when you see it permeating through the rest of the structure and you know that slowly that ripple of change is coming and things are going to get better. So we're not having to shoehorn ourselves into certain areas, locations, clinics, just to get the right care. Another point I want to add though about sometimes if you do have a negative experience, it's worth checking around, seeing if you can register at different places, get in touch with other people in the community, see if they've had better experiences. For some screening, you can go to a sexual health centre, which may be a little bit better so that they're, you know, less squeamish about talking about sex. So, you know, don't let one negative experience block off any screening or any sort of preventive health or any sort of updates.
I think that's really good. And I hadn't quite realized that in order to get a lanyard, they had to sign something, but that's like an extra.
For the badge. I think the lanyard's a fair game, but for the badge.
Good to know. They want it on the table somewhere and someone picks it up. So that's really good. So, so when somebody maybe is, you know, going through a lot, and then of course, like cancer, COVID, and also dealing with this, and they're looking for support, what are some of the barriers that people have found accessing sort of support groups?
I'll start this one off and then I'll hand over to Camilla. But anybody can do this as a quick test, and I promise you, if you just go up and search breast cancer on Google, all the results are pink. And you've got to think about how many other people get cancer, and especially, for example, if a trans man is experiencing it and they have gender dysphoria and they don't want to read about breast this, breast that, breast that. You know, there's so many ways that it can be a barrier. And this also then goes into the support groups. The support groups are heavily gendered, and the support groups are overly attended by white women. So that can be quite exclusive to a lot of people that want to seek support. And even from my experience, so I identify as non-binary, so I don't really sort of center into male spaces and don't find comfort in them. But whenever I would go to sort of Macmillan or whichever support, really, that's the first thing they would offer, because they would see me make a snap judgment and say, okay, you need to go play sport with other young men. And so, but what you haven't done there is you haven't asked who I am or what I take comfort in or what my community is or what my identity is. And unfortunately, I think that's one of the things that becomes a barrier as well. So you don't really get to tell people what you want or what you need. People just think, and I know sometimes it's a volume thing. They've seen so many patients and they just need to get through it. And I do appreciate that. But one of the biggest kind of experiences I've had that sort of still sticks with me is going into a very beautiful new cancer centre with leaflets all up the wall, over 100 different types of leaflets, and not one being about LGBT relationships. And it's so important because that's LGBT, that's the whole community. That's not even the specific factors that we all share, and then we have our all differences as well. So I think there's a lot more that needs to be done, and we're obviously doing that by providing peer support for anybody in the LGBT community. And there are some other ones like Walnut that's specifically for men who sleep with men who have prostate cancer, and there's also Out With Prostate Cancer, which is up in the north, which is connected. So there are little pockets, but there definitely needs to be a lot more.
I think that was one of the things I really liked about Shine, was because it was anyone of any cancer, any gender, that, yeah, and it gives you so many more people to relate to, because it isn't, sectioned off in the way that some support is. So Camilla, if someone is looking they've kind of heard this today and was like, I'd like to kind of do a bit of a deeper dive, other people, is there somewhere that you would recommend to go and get support?
Yes, I think firstly, I think you should ask your GP if you can, where the support locally that you can actually you can get, and like for example in Tower Hamlets, there's a lot of support that you can get. You can get support from Mind Rainbow. You can get support from the East London Out Project. You can support from Albert Kennedy Trust. I'm a board member for Spectra, and so you can get a lot of help and support also from Spectra, and Spectra serves for the underserved communities, in not just LGBT, but also women from ethnic backgrounds. And there is a support group that we run a support group on a weekly basis for trans people. So, and now there are also more access to trans health. They are going to launch Indigo services in Manchester soon. There is 5060 at Dean Cross Street in Soho, London. And that is also going to, I think in Liverpool is going to also start a new services for trans people. And I think one of the barriers of people not having of not reaching out for support is, I think, maybe because they are angry. They're angry of that they are being treated badly. They're angry about that that have to wait for so long to get access to some hormonal treatment, and they're angry about that the negative experiences that they have. Yes, I can understand the anger, but but please reach out for support. There's a lot of people out there who will support you, who loves you for who you are, and if you reach out support, you found so much comfort from the support services that is available.
Yeah, I agree with that, and I just want to add a personal experience. So before doing all the work I'm doing and getting involved and getting more in touch with Shine and starting my own charity, I felt so alone going through cancer. Like, I don't have a very supportive family. They're not very involved. I haven't had a partner, like a substantial one, to kind of ride this out. I have incurable cancer, so I don't fit into other groups. All the conversations around my health don't fit me because everybody asks when I'm finished, or the other side is people say, we don't look ill. But yet, my whole life has changed. And there was a time when I didn't even recognize myself because I wasn't the person I was, and I didn't understand where I was going or how I could deal with it. And it wasn't until I really started to make efforts, and I think that's it. I think sometimes when you are vulnerable and you're upset and you're angry, you want people to do it for you and come in and fix your life and shake you up. And unfortunately, unless you have someone that is already doing that, you can't wait for people to do it. You have to reach out first a little bit, and then people will reach back. And the more I got in touch with my LGBT community, the people around me, the people in the third sector, people who were change makers and were brave enough to share their story, like yourself, Ted, like yourself, Camilla, people who I could listen to and vicariously take power from and just kind of feel empowered by, that was the game changer for me. And it's helped me make peace with my diagnosis, where my life is heading, what purpose I can kind of make out of what I've got. And I don't feel as angry or alone anymore.
Yeah. mean, I call you Stuart, and then only once when I stopped becoming angry, and then I said, I must do something, for for the trans people, and oh gosh, that's the fact there is no cancer screening guidelines for trans people. I stopped becoming angry. I know what I did was I wrote those guidelines and I presented it to Public Health England and London, and then I said, look, you don't have those guidelines. Could you publish it? Let's talk about it. And it's much more positive for me. Ever since I become my anger, I think personal experiences.
And I think one of the things that we just because we could talk all night,
all day.
is that, of course, there's so many, like, not just being in a healthcare setting, but relationships, families, there are other factors and that come into play, that getting that support. And what you've just both said so wonderfully is that, like, there is something empowering when you bring yourself, right? So that there's sometimes you need to sort of section things off and compartmentalize, and you're in safety mode, you're just getting through, you're just plowing through it. But then there is that point where, if things have been building up, that actually taking your whole self as you are and reaching out to other people is incredibly beneficial. Oh, I just love those smiles.
No, definitely, yes. It's just like, I could not have become who I am now, and I could not be, thriving without the support and the kindness from my family, from my friends, my colleagues, and even from my patients. And until even now, I'm still very grateful. And I could still remember the day when I announced my intention to transition in my workplace, and everyone was just so happy for me, and they congratulated me. And even until now, I could not forget the happy faces, because they're happy for me. And it is such an uplifting experience for me. And I always tell everybody, acceptance and tolerance, not just an uplifting experience for me, but it is also an uplifting experience for those who are accepting.
Yes, it gives everyone the opportunity, doesn't it?
Yeah.
Thank you so much, Camilla. It was really lovely to talk to you, and that you're on the healthcare side of things, to kind of bring that into. It's been really, really great. We are going to say goodbye to you, and then myself and Stuart are going to answer some of your questions. So send them to us. Thank you, Camilla.
Thank you.
Now we'd love for you to be part of this conversation. So you can either share your smile and chat with us, or you can use the chat box. Either way, yes, coming to you live. Be right back.